Welcome to Flavors for Life Healthy Culinary Movement. Let's learn about irritable bowel movement, or IBS. According to a clinical review published in the Journal of American Medical Association, IBS affects between 7% to 21% of the general population. The amount of people who now struggle some form of IBS is estimated to be a shocking 60 million people in the U.S. alone. What is IBS? IBS is a very common disorder that affects digestion, especially by interfering with normal functions of the large intestine. IBS is not a single disease, but rather a symptom cluster resulting from diverse pathologies. This means that each person with IBS can struggle with different symptoms and have their own unique triggers. IBS symptoms: bloating and gas, cramping and abdominal pain, diarrhea or constipation, or both, changes in poop color and appearance, including having loose stools or mucus in stools. IBS causes. Some common underlying causes and triggers of IBS can include eating a highly processed, usually low-fiber diet, food allergies or intolerances, sensitivities, stress, inflammation and free radical damage, oxidative stress that can damage the intestine, nutritional deficiencies, use of certain medications that can cause constipation or diarrhea, poor lifestyle choices such as drug use, smoking, and high caffeine and alcohol consumption, SIBO, gastroenteritis, or infections of the digestive system, hormonal changes such as menopause or shifts during the menstrual cycle, dehydration, leaky gut, sedentary lifestyle. The IBS diet. Here are the top IBS diet foods that are recommended. Homemade bone broth. Bone broth will provide your body with proline and glycine that make up collagen, and which can help repair intestinal permeability. Raw kosher dairy. Probiotic foods like kefir and yogurt can help heal the gut and balance your microflora. Also, when buying dairy, look for raw, organic goat milk products or dairy that doesn't contain A1 casein. Clean, lean protein. Protein deficiency is common in people with bowel disease. Therefore, try to eat at least 3 to 4 ounces of protein per meal. Fresh vegetable juice. If the vegetable juice does not worsen the diarrhea, vegetables can help provide critical electrolytes. Steamed vegetables. Non-starchy vegetables that are cooked or steamed are easy to digest and are an essential part of the IBS diet. Healthy fats. Consuming healthy fats in moderation like egg yolks, salmon, avocados, ghee, and coconut oil are easy on the gut and promote healing. Fruit. Consuming fruit in moderation, about 1 serving early in the day, is usually okay for those who struggle with IBS. If IBS is severe, you may want to try steaming apples and pears to make homemade applesauce. Foods to avoid. Foods that cause gas. Carbonated and alcoholic beverages, caffeine, raw fruit, dairy, and certain vegetables such as cabbage, broccoli, and cauliflower may make gas worse. Spicy foods. Hot and spicy foods can cause heartburn, acid reflux, and IBS symptoms to become worse. Sugar and refined flour. Bacteria love to eat sugar, and sugar reduces immune system functioning. Whole grains. Any type of whole grain will contain phytic acid and starch, which can irritate the intestinal lining, causing gut issues. Gluten. A gluten-free diet can help improve the symptoms of bowel disease. If you suspect gluten contributes to your symptoms, avoid all foods made with or containing wheat, barley, and rye grains.
For more educational videos, please visit our YouTube channel at youtube.com/c/flavorsforlife.